Here we have got 35-year-old with left-sided sciatica. We have got sagittal T1, sagittal T2, and stir and axial T2 sequences. I have magnified at the level of L45 and L5S1. I'm interested in showing L5S1 level where the disc is dehydrated with annular fissuring and also shows a small broad-based central posterior disc protrusion in addition to mild disc bulge. The thecal sac appears capacious and there is no evidence of impingement on the traversing S1 nerves. Now we look at the exiting nerves. Many people try to assess the exiting nerves on the axials, which I think is not correct. It's because there is partial volume averaging from the disc, from the bone, and from the nerve, and also the fat plane around the nerve is not well appreciated on the axial sequences. The nerve also courses very obliquely, and it is not possible to get true axial views of the exiting nerves on the axial. The best sequence to assess the exiting nerves is sagittal T1 because there is a good amount of fat around the nerve at the level of exit foramen. For example, if we see at L4-5 level, there is nice fat around the nerve and the nerve appears normal in size compared to one above and below. Similarly, at L5S1 on the right side, we see good fat around it and there is no evidence of any impingement on the exiting right L5 nerve. But as we go to the left side, compared to the one above, you can see the fat plane is completely effaced, but still we can see the nerve nicely, which is of similar size. So this is what I call as mild impingement on the exiting left L5 nerve. As it comes out of the exit foramen, we start seeing the fat around the nerve and it is not impinged there. If we look on the sagittal T2, we can appreciate similar finding, but it is much better appreciated on the sagittal T1. Since fat is saturated on sagittal stir sequence is not a good sequence. We can correlate then with the axial to assess the degree of impingement, but the primary sequence which I use is the sagittal T1 sequence to assess the degree of impingement of the exiting nerves. In summary, in this case, there is mild impingement on the exiting left L5 nerve due to disc bulge.